Welcome back to another episode of Med Madness podcast, where we dive into the complexities of medical management and share insights that can make a real difference in patient care. Today, we're focusing on an essential topic, managing HIV during pregnancy. It's a critical aspect of care that aims to ensure the health of both the mother and the baby, while minimizing the risk of mother-to-child transmission of HIV. Managing HIV during pregnancy requires a meticulous approach, beginning with antepartum care. One of the key elements here is the regular testing of HIV-1 viral load. Initially, this testing should be conducted monthly until the viral load becomes undetectable. Once this goal is achieved, the frequency can be reduced to every 3 months. Monitoring the viral load closely helps in assessing the effectiveness of antiretroviral therapy, also known as ART, and ensuring that the virus remains suppressed. In addition to viral load testing, CD4 cell count monitoring is equally important. This test, conducted every 3 months, provides insights into the immune function of the pregnant woman, helping healthcare providers decide if prophylaxis against opportunistic infections is needed. Maintaining a healthy immune system is crucial for both maternal and fetal health. Resistance testing is another vital step if it hasn't been done previously. Understanding any resistance to ART medications can guide adjustments in therapy to ensure the most effective treatment regimen is in place. The goal is to achieve and maintain viral suppression, which is pivotal in reducing the risk of transmitting HIV to the baby. Antiretroviral therapy should be initiated or continued for all HIV-positive pregnant women. This ongoing treatment is fundamental to achieving undetectable viral load levels. One important precaution to note during this period is the avoidance of amniocentesis if the viral load is detectable, as this procedure can increase the risk of transmitting the virus to the fetus. Now let's move to intrapartum care. During labour and delivery, certain procedures should be avoided to minimize the risk of HIV transmission. These include artificial rupture of membranes, the use of fetal scalp electrodes, and operative vaginal delivery. Each of these interventions can potentially increase the risk of the virus being transmitted to the baby. The mode of delivery is largely determined by the viral load at the time of labour. If the viral load is at or below 50 copies per milliliter, the recommended approach is to continue ART and proceed with a vaginal delivery. This low level of viral load indicates a very low risk of transmission, making vaginal delivery a safe option. If the viral load is greater than 50 copies per milliliter but does not exceed 1,000 copies per milliliter, vaginal delivery can still be considered. In such cases, ART is continued and zidovudine may be added to further reduce the transmission risk. However, when the viral load exceeds 1,000 copies per milliliter, the safest course of action is a caesarean delivery. This, combined with ART and zidovudine, significantly reduces the risk of transmission during birth. To bring this discussion to life, let's consider a real-life case study. Imagine a 32-year-old pregnant woman, newly diagnosed with HIV. At her first prenatal visit, her HIV-1 viral load was measured at 150,000 copies per milliliter, and her CD4 count was 350 cells per cubic millimeter. Resistance testing revealed resistance to some first-line RT medications, so her healthcare team tailored a regimen that included drugs to which the virus was susceptible. Over the next few months, her viral load dropped significantly, becoming undetectable by her 3rd trimester. Despite her initial fears, she continued with regular appointments and adhered strictly to her ART regimen. As she approached labour, her viral load remained undetectable. Following the guidelines, she was able to have a vaginal delivery with continued ART. Both she and her baby were healthy, and the baby tested negative for HIV. This case underscores the importance of comprehensive HIV management during pregnancy. With vigilant monitoring, appropriate use of ART, and careful planning for delivery, the risk of mother-to-child transmission can be minimized, ensuring healthy outcomes for both mother and child. Thank you for tuning in to this episode of Med Madness podcast. Remember, proper management of HIV in pregnancy is a critical component of maternal and child health. Stay informed, stay compassionate, and join us next time as we continue to explore important medical topics that matter to you. Until then, stay healthy and stay curious.